Hello, my name is Lori Wood. I'm a public health dental hygiene practitioner and a community dental health coordinator. I work at Wayne Memorial Community Health Centers. It's in Northeast Pennsylvania. It's about an hour north of Scranton. We are a federally qualified health center. And the unique in our office, we have 2 dental sites, and then we have about 7 medical sites. As a public health dental hygiene practitioner, that allows me to go to our off-site medical sites and provide preventative dental services. As you noticed before, they were saying for most people, it takes like 15 minutes to get to the local dental office that provides that offers medical assistance. That is not it in our case. It's could be from an hour to an hour and 45 minutes to the closest dental site for our patients. We serve Wayne County, Pike County, and part of Lackawanna County. So for some people, cost efficient for them to come all the way to our dental center could be a problem. So I know that they said that cost was a big deal with people not being able to go to the dentist. So I'm able to provide services at our far off medical sites. So what we do is when somebody is there for a wellness visit, they can sign up to also be seen by me to provide preventative services. I have mobile dental equipment. I have a dental chair. I have a Nomad, so I'm able to take dental x-rays. And I'm also being able to, if we have a problem with a patient and we need a dentist to be able to review those x-rays immediately, I'm able to call our office and email them the radiographs so that they can take a look at that, which is very important. We had a case where we had a patient who was diabetic, and when I was looking over her health history, she said that she has diabetes, and I said, well, do you have any dental problems or any dental concerns? And she said no. And then I took an x-ray, and I was like, oh, this tooth here is not bothering you? And she said, well, it was, I haven't been able to eat in 3 days, but, it's starting to feel a little bit better. Well, in that case, I was immediately able to have our dental provider in our Honesdale office take a look at the x-ray, and we were able to call in a prescription for an antibiotic, and she was seen the next day in our Honesdale office. So we're able to make those appointments immediately for them. When I provide the preventative services, that include sealants as well, immediately everybody is given an appointment to come to our Honesdale office to see the dentist for a dental exam and treatment plan. And then I'm able to follow up with that to make sure that they do come, and if they don't come, I'm able to call them up and find out exactly why they didn't show for their appointment. Because that's the thing that's really important with our dentists. They really appreciate me going out and providing these services, but they want to make sure that they're coming back to our office to seek treatment. Because it doesn't do me any good to be out there and doing these prophies and these preventative services if they're not coming back in to have the treatment done. So we're able to follow up with that. The majority of the patients that I see, probably about 95% of them, are new patients, and they haven't been to the dentist in 5 years or more. So that's really huge, being able to provide more patients to our dental practice, as well as being able to serve their needs. Like I said, a lot of times transportation is an issue because it could be an hour and 45 minutes to their visit. We don't have public transportation. We have county transportation. And how that works is you have to call 3 days before your dentist appointment. And your dental appointment could be at 10 o'clock, but you will have to be there at 8 o'clock because you get picked up and then you have to wait until they're done. So you could be there at 10 o'clock and not leave our dental office until 3, until county transportation comes back and picks you up. So that's a huge benefit, being able to provide these services at our medical sites. It's a lot closer for them. They don't have to worry about paying for gas or even paying for somebody to watch their other children while they come to the dentist. So that's a really nice benefit. Also, the fear of going to the dentist. Our dental office has 10 operatories, and we're really busy. So the waiting room is very crowded. There's a lot of activity going on. When I'm at the medical sites, it's more one-on-one. It's a lot quieter, so they're able to tell me what their fears are, make them feel comfortable, and then it's a really nice handoff when they come to our Honesdale office, because I can inform the dentist exactly what their issues are, if they have any fears, if they have any concerns, and I always pop my head in when they have their appointment with the dentist, so that as a friendly reminder saying, oh, yep, remember you seen Lori over in Hamlin or Carbondale? And they're like, oh, yep. So it makes that easy transition to reduce their fears. Like I said, most of the patients that we're seeing haven't been to the dentist in 5 years or more. So that's really nice. So that's what our office is doing, and we really truly appreciate being able to utilize a public health dental hygiene practitioner.